Do this. Okay. So let's talk about the immune system. So first of all, what is the immune system? Let's just start there. Start foundational, work our way up. What is the immune system? What's that? Okay, so a big role of it is to prevent and to fight infections.
Got your antibodies and immunoglobulins.
Okay, so part of that
Barriers.
is okay, they're barriers, protective barriers, antibodies, or immunoglobulins, which same thing, mean the same thing. Okay, good. Yeah, so the immune system you can look at is doing three primary things. So it protects the body from foreign invasion. That's the first major thing that the immune system is involved in. Okay. It also enhances repair of injury or illness associated issues. So when we talk about repair after trauma or repair after infection or repair after some medical problem, the immune system plays a key role in that. And then last but certainly not least, it is involved in the identifying and dealing with faulty cells, okay, with cells that may be mutated in a way that is abnormal, or cells that just aren't working, right? Cells that have become necrotic, or cells that are misfunctioning, they've lost their specialized function, whatever the case may be, the immune system can take steps to initiate what's known as apoptosis. You guys familiar with that term, apoptosis? What does that mean? Programmed cell death, yeah. So it's basically an organized way to die, right? Basically, it's the immune system telling the cell, kill yourself, and the cell's like, oh yeah, I've got a plan for that, right? And it happens in a planned way. And then necrosis is the cell getting killed, and that tends to be a little more disorganized. Cool. All right. So I think I've mentioned this earlier, but aside from the nervous system, the immune system is one of the few systems that actually has this concept of memory. And memory is a critical part of the immune system, specifically when we talk about antibodies and antigen complex reactions is primarily due to the immune system's ability to remember what's going on.
Is that where the term building immunities comes from?
Yes.
Like when you get sick?
Yes, it's absolutely where it comes from. When you develop immunity, or when you are given a vaccination and you develop immunity. And we're going to actually talk about how that works in a little more detail, because this is not intuitive. It's actually kind of hard to understand. So we'll try to tease out the main points and make this a little more intuitive. So like any other system in the body, and we've taken more or less a systems approach to all of the issues that we've talked about in paramedic school, right? We've talked about the cardiovascular system, the respiratory system, the nervous system, the gastrointestinal system, et cetera, et cetera. The nervous system, or the immune system rather, has specialized tissues and organs, just like all the other systems. And so I want to talk about some of these tissues and organs, and perhaps we'll start at where it all comes from. And this is a direct extension of the hematology lecture that we've already had. There is exceptional crossover between the immune system and hematology, because the progenitor cells, right, the stem cells that make a lot of this immune tissues, where do they originate? Well, they originate in bone marrow. These so-called progenitor or stem cells. And remember, we talked about this in hematology, these stem cells then differentiate into the white blood cells. And this is a significant component of the immune system. It's not the only component, but it certainly is a significant component. So let's just review the general types of white blood cells. So remember, we have granulocytes and agranulocytes. And the granulocytes contain little granules, right? And those little granules, of course, are little lysosomes containing enzymes primarily. Enzymes that are proteolytic and help to destroy invading organisms such as bacteria primarily, some of the granulocytes, such as the basophils, right? The basophil's a special kind of granulocyte that doesn't contain so much of the enzymes, but rather it contains lots of histamine. And that's important when we talk about inflammation and the inflammatory response, which we'll get to. So your neutrophils, your eosinophils, and your basophils are your granulocytes. And then your agranulocytes are your lymphocytes and your monocytes. All right. And just to review terminology, remember cytosis generally means an increase in the number of cells. And then penia means a decrease in number of cells. So leukocytosis would be elevated white count. And just to go back, remember the norm is 5 to 10. And let's just review our CBC. So our normal white count is about 5 to 10. What's our normal hemoglobin?
15.
About 15. Hematocrit? 45. And that is, of course, the rule of threes that you guys learned in hematology. Okay, so leukopenia would be decrease in white blood count. And remember we talked about what a left shift is? When somebody reports that the patient has leukocytosis with a left shift, that refers to the neutrophils, and there are two general types of neutrophils. We've got the immature neutrophils and the mature neutrophils, and the immature are the banded, and the mature are the segmented, and that has to do with the morphology of the white blood cell when we look at it in a microscope. And we know that the body is somewhat of a bastard when it's under attack, right? It sends women and children to the front lines. And so you have all these immature kiddos, these little baby white blood cells being shipped off to the front lines to die. And we know that neutrophils are basically like suicide bombers, right? They kill themselves in the act of phagocytizing foreign invaders, primarily bacteria. Okay. So if you have leukocytosis, you want to do a manual differential, right? Or a differential, and look at the neutrophils. And if you have elevated in your banded neutrophils, that indicates an acute infective process, generally bacterial in nature. All right, that's called left shift. Remember, manual differential is looking at all the individual white blood cells as opposed to the total white count, which is what we're looking at here, right? The total white count. And then we differentiate that into what percentage of that, right? What percentage of that 10,000 cells is going to be neutrophils, and what percentage will be lymphocytes, monocytes, eosinophils, basophils. Okay. Pathogenic, right? So a pathogenic means disease-causing, right? You guys okay with that? Antigenic is not pathogenic, okay? Don't get those two terms confused, and we'll talk about what an antigen is, but antigenic is not pathogenic. But pathogens contain, embedded within their cell walls or within their capsids, if we're talking about viruses, they contain material that is antigenic. And so pathogenic is disease-causing, and then antigenic is more like the ability to elicit an immune response. So an antigen is some molecule, and it tends to be a complex molecule like a protein. They're almost always proteins. And it is a protein that can elicit an immune response. Okay, you guys good with that? Okay, so that's a big part of our immune system, but we also have other tissues that are important. Specifically the lymphatic tissues, all right? And you guys are familiar with the lymphatic system, right? It's a big part of our immune system, and it consists of lymphatic vessels, and these vessels go into areas known as lymph nodes. And what lymphatic vessels do is they drain off the interstitial fluid. So fluid in your interstitial space is absorbed into the lymphatic vessels, and then those lymphatic vessels bring that fluid back into a lymph node. And basically a lymph node is an area where you have a large collection of white blood cells. And they more or less filter, quote unquote, filter that lymph fluid out. And then that lymph fluid gets put back into the central circulation, right? It gets dumped back into the vena cava where it enters our systemic circulation. And there is this term called lymphadenopathy. And what does lymphadenopathy mean? If someone has lymphadenopathy, what does that mean?
Enlarged lymph nodes.
It means lymph nodes that are enlarged, right? Typically, where we will appreciate enlarged lymph nodes, not the same thing as glands, right? But typically, where we'll appreciate enlarged lymph nodes will be in the axilla. You have lots of lymph nodes in your axilla, all right? You also have lymph nodes in your neck, all right, and your groin as well. Now you have, like I said, you have about 600 lymph nodes throughout your body, and a lot of them are internally, and you wouldn't necessarily be able to appreciate them being swollen. And what does a swollen lymph node mean? Well, it means lots of things. It can mean infections. It can mean sometimes it's idiopathic. We don't know. It might even mean neoplastic disorders, right? Certain types of cancers like leukemias and lymphomas are really good at causing lymphadenopathy. So lymphadenopathy is rather nonspecific. And then the spleen is a very important immune organ, right? Lots of cells are contained within the spleen, and the spleen is, in some sense, like a very large lymph node for the blood. And so that's why it's such a vascular organ. And we know that if your spleen has been removed, right, if you've had a splenectomy, are there problems? What are the major problems that result from having a splenectomy?
Immunodeficiency.
Yep, immunosuppression, yeah. People have their spleens removed tend to be immunosuppressed, particularly kids, right? And so that is yet another cause of a compromised immune system, is having a splenectomy. And then I just wanted to mention this because this has become so important and it has been overlooked for decades, and we're just now beginning to realize, holy cow, this is huge and this is important. And these are what are known as the gut-associated lymphatic tissues. These are also known as GALT. And then you have the mucosal-associated lymphoid tissues, okay? Or I guess you could call them MALT, right? So gut and mucosal. So your mucous membranes have lots of lymphatic cells in them, right? And your gut has a large amount of lymphatic and lymphoid type tissues in it as well. And we know that maintaining a gut biome, right, a healthy environment where normal bacteria can flourish and live in your gut normally is incredibly important. And we have now begun to find out when that biome becomes altered, right, that can cause severe problems and set you up for severe issues such as infections, right? That's one of the most common things, infections, digestive disorders, malabsorption disorders, even obesity has been linked to alterations in the gut biome. So this is really important. And what kinds of things alter these gut-associated lymphatic tissues in the gut biome? Well, being sick in general, right? What happens when you get sick is you have a stress response, right? You have a sympathetic response, and part of that sympathetic response is the release of steroids, cortisol, that suppresses the immune system, right? Alters the gut biome. Putting people on antibiotic or antimicrobial therapy, really bad at altering your gut biome, right? And so what should we be doing as a general rule, anybody who receives antibiotics? They need probiotic therapy, yeah. They absolutely need probiotic therapy. And we know that they're going to be at risk for lots of different opportunistic infections, right? Candidiasis or yeast infections, opportunistic bacterial infections like Clostridium difficile, and et cetera, et cetera. So
Does that stop the memory cells from being able to?
no, it actually doesn't really stop the memory cells. Really what it is with the gut is you have healthy bacteria in your gut that keep the harmful bacteria at bay, right? So if you have all of these, and we're not even sure how much healthy, and we're still kind of figuring that out, a lot of it, but more or less, you have in your gut, there are as many bacteria in your gut as there are cells in the rest of your body. Right, so for every cell that you would say, oh, this is my body cell in your brain, your heart, right, you have a roughly equivalent number of that in bacteria in your gut. So it's really important, and there's a real important balance. And when you have an imbalance, you get sick or you put in an antibiotic, and that takes out part of that biome, other cells, because they're competing, right? There's selection pressures, and they're competing, and they're kind of fighting for dominance. And if you take one factor out, right, that you take that competition out, then whatever that bacteria that was competing against can then colonize and become dominant, and that gives rise to these problems like Clostridium difficile. Clostridium difficile is extraordinarily common in people on antibiotics. You don't tend to see this in healthy people at all that have a. And what's the most effective treatment for things like C. diff now? Transplanting the biome from one person into another. Yeah, literally recolonizing their gut with poop, basically putting poop into them. Yeah, it's an interesting thought for sure. Yeah.
I think it get abscesses as well with overtaking antibiotics, correct?
What's that?
Abscesses.
Well, an abscess is just a large an infection that gets walled off and forms a large collection. That's what an abscess is. So.
We were told that too much antibiotics could cause that too.
Well, yeah, if you get an opportunistic infection, that abscesses, it sure can. Yeah, for sure. All right, so you guys go with that, kind of the overview so far? All right, well, let's move right. All right, so what I want to do now is I want to take a look at the different branches of the immune system. So like the nervous system, the immune system has different branches. All right, so let's just start here. So here I have the immune system, right? The white cells, the marrow, collectively known as the hematopoietic cells, the lymphatic tissue, the lymphoid tissue, the spleen, the barriers, etc. And when we look at this, the easiest division to make is we can divide this into two general areas. Okay, we have what is known as the innate immune system and the adaptive immune system. Okay, so you've got the immune system, and then under the umbrella of the immune system, you have the innate and the adaptive. You guys good with that so far? So, and they cross over, right? They're not separate. There's really significant crossover, but this is the simplest way of getting some intuition about what's going on here. So let's talk about the innate immune system first, because it's a little easier to understand at the beginning. You guys go with that? So the innate immune system is also known as the non-specific immune system. Okay, so there is not memory. You do not have the quote-unquote concept of memory with the innate or non-specific immune system. All right? So what is the non-specific immune system primarily made of? It is primarily made of physiological barriers. That's the first major part of it. Okay? So these are things that prevent foreign invasion, right? And you can kind of think of it as an army, right? When you look at an army, or you look at protecting your country, right? You have the innermost protection, right? And you've got these barriers. You've got what? Fences and walls and checkpoints and immigration point, right? And you try to prevent bad people from coming into your country, right? That is roughly analogous to the concept of a physical barrier in immunology. And so what are these physical barriers? Well, these are our mucous membranes. Anywhere you have an internal part of your body that is exposed to the external environment, you will have a mucous barrier. You have a mucous membrane. So where do you have them? You have them in your airway, right? All along your airway tract, you've got a mucous membrane, because the airway interfaces with the external environment, right? Even though it's inside your body, you're still breathing air from the external environment, and that air is interfacing. So you have a mucous membrane to protect those airways. You have this in your gut as well, your gastrointestinal tract. You have a mucous membrane. Why? Because you're taking food from the outer environment and you are putting that food into your body, and then it is going through your body. So you have mucous membranes there as well. Your genital urinary tract, right? Your urethra, your bladder, okay? Right? They're covered in mucous membranes, right? The vagina, right? The vaginal canal, it communicates with the external environment. It is also covered in mucous membranes because it interfaces with the external environment. Oil on skin, right? Your skin secretes oils. And those oils contain numerous enzymes that help prevent colonization of bacteria on your skins. Intact epithelial barriers, right? So your skin, right? Your skin is what? Squamous cells, right? Stratified squamous cells. And if those cells are intact, right, they act as a physical barrier. They're very important. So anywhere you have the outer part of your body interfacing with the external environment, you will have intact epithelial barriers, right? Skin primarily. Tears, right? You have your eyes, right? Your eyes have not only epithelial tissues, but they have tears that are constantly lubricating them. But those tears contain lots of enzymes that prevent colonization.
So with chronic dry eye, how does that affect that part of the?
Yeah, you can actually be prone to developing ocular infections.
To a glaucoma, or would it go that far?
What's that?
Causing a glaucoma?
Well, glaucoma is not really an infection.
But would it cause just the buildup of something cause it?
Yeah, so it can cause basically colonization. You can get organisms colonizing, those chronically dry eyes. And then the eyes are generally chronically irritated, and you get inflammation, and there are other problems there as well. And then stomach acid, right? Stomach acid is a very effective physiological barrier because it kills lots of things that get in there. Okay, you guys go with that? So that's one specific part of the non-specific immune system. The other part are what we call our phagocytes. And what does it mean to phagocytize? To engulf. Yeah, these are cells that eat foreign invaders. Okay? And they don't do this in any specific manner, right? It's not like there's a real specific thing. It's these, right? These cells are there and they just kind of generally respond. And these include things like dendritic cells, macrophages. And remember, macrophages and dendritic cells are basically just monocytes that migrate out of your blood and into the tissues. And your neutrophils. Your neutrophils are actually the most numerous phagocytic cells in your body. Okay? So these are all specific types of white blood cells. The dendritic cells, the macrophages, the neutrophils, they're just specific types. Okay? You guys good with that? So far so good? All right. Okay? And then another important part of the non-specific immune system, or the innate immune system, is the inflammatory response. And this is often mediated through mast cells. The mast cells degranulate, they release histamine, okay? And that elicits what's known as the inflammatory response. And why do we want to have an inflammatory response? What is the role of inflammation? Why is it an important part of the immune system, of the non-specific? Well, what happens?
Infection?
Huh?
It closes off infection?
Well, it can, but
With histamine?
yeah, so when you get a histamine release, and we're going to talk about inflammation in a lot more detail here in a little bit, but we're looking at it a bit more generally here. So when you have an inflammatory response, what does it look like? What does it feel like?
Heat.
Because you get heat, you get redness, you get warmth, Um,
It's like pressure almost.
and you get pressure, and all of that, a lot of that is due to increased capillary permeability. So your capillaries open up and they become leaky. Why would you want leaky capillaries in an area where there's infection or injury?
So we can get, what's this?
Good, so you can get the immune system into that area more efficiently, and you can get nutrients into that area as well, right? Okay, and we know that the elevation in temperature will increase metabolism in that area, and the elevation in temperature is potentially problematic to certain types of organisms. They don't tolerate that temperature as well. So that's also another role. And then a big part of inflammation is, what does it feel like?
Pain.
It hurts. Why would you want an area that is damaged or infected to hurt?
It releases, the sensory.
So you don't mess with it.
Serotonin and
There you go. So you don't mess with it, right? You want it to hurt because you want to know something's wrong, right? If you break your leg, you kind of want to know it's broken, right? So you can quit walking on it and give it some time to heal, right? If you didn't have an appropriate inflammatory response and a pain response, and you didn't know it was broken, and there are human beings, believe it or not, that don't have a normal pain response and
Is
can.
that that disorder where they can't
There
feel
are.
anything?
Yeah, there are
a
disorders.
couple,
Huh?
a couple disorders that do that.
Yes.
right?
Yeah.
They can't feel heat or cold either. right?
Yeah. So that's really, really
They have to
problematic.
keep constantly checking for
Yeah.
bruising and.
Yeah. And this is part of diabetics, right? How diabetics can get infections and injuries, and how they can even have heart attacks and not necessarily be aware of it because they have neuropathies developed due to elevated blood sugar that destroys the peripheral nerves. It's called peripheral neuropathy. So that's an acquired way. And then, of course, there are other, ways and, genetic issues that you're born with this. So it's really problematic. Good. Okay. Now, I am not going to talk about the complement pathway and the antigen presenting stuff quite yet. So, immune system, the innate immune system, this is non-specific. It includes physiological barriers, phagocytic cells, and the inflammatory response. Those all fall under the umbrella of your innate immunity. And so this is the immune system that every person has. Everybody has this. You are born with this. Okay? The adaptive immune system you acquire. This is known as the acquired, or sometimes known as the specific immune system. It takes time to develop this, and you are constantly developing this throughout your life, and this is where the concept of memory comes into play. So, to make a clinical connection here, is a temperature of 101 particularly concerning in an adult patient? Not necessarily, right? Looking at it generally, right? You get a fever, sick, you got a cold, right? Go home, eat some chicken noodle soup that grandma made, cry a little bit, hug the teddy bear, you'll be okay normally, right? You all are gonna feel that way, and then you're gonna cough and sneeze all over me, and then you're gonna make me feel that way, right? It's gonna happen here in a couple months. It's already happening, right? However, in newborns, this is a problem, right? Yeah, the newborn does not have a well-developed adaptive immune system, which means if a newborn gets an infection, what is the only way they can, what do they have? What tools do they have to fight that infection with? What immune system do they have? All they have is the innate, right? All they have are these physiological barriers, these phagocytic cells, and the inflammatory response. Which means that if you have a fever in a baby, right? Temperature generally greater than about 100 degrees, 100.8, 100.9, right? In a baby, that is critical. That is a critically ill kid. Why? Because that's all they have available to fight that infection, right? They don't have antibodies.
That's from newborn to 4 months.
Yes, Yeah, for the first few months of life, yeah. So 101 or greater, that's a septic kid. That is a full septic workup, and that is sepsis until proven otherwise on that kid. And hopefully that explains why, because they don't have the adaptive immune system, right? You guys good with that? Okay, so let's talk about how we develop the adaptive immune system. This is also known as the specific immune system, and perhaps one of the most important parts of our adaptive immunity will be lymphocytes. Okay, will be lymphocytes. You guys good with that? And we have two major types of lymphocytes. We have what are known as the B lymphocytes and the T lymphocytes. The B lymphocytes mature in bone marrow, and that's why we call them B lymphocytes. You guys have all learned this already. And then the T lymphocytes mature in response to thymosin from the thymus gland, and this is much more important in kids than it is adults. And that's the reason we call them T lymphocytes. You guys go with that? Okay, so the B lymphocytes primarily are responsible for something known as your humoral response. So under the umbrella of specific immunity, you have the humoral response. The humoral response, again, is typically due to B lymphocytes. And the reason we call it humoral response is it goes back to ancient Greek and Roman philosophy. And in ancient Greek and Roman, not philosophy, but just life and the way that they communicated, they would say that you have humors in your body. And humors are body fluids, like bile, right? Bile is a type of humor. Blood is a type of humor, right? And so the humoral response occurs within your body fluids, within your humors, right? So we're talking primarily blood and plasma, all right? So humoral response, typically due to B lymphocytes, and this is occurring in your blood and blood plasma. You guys good with that? Okay. So far, so good? All right. So this is extracellular. This is occurring outside of the cells themselves. Okay, good with that? Extracellular, it's a humoral response. It's due to B lymphocytes. Okay, so how does this work? How does this work? Okay. So to understand how this works, we need to go back to the innate or non-specific immunity. And this is where the great crossover occurs. And we're going to talk about the phagocytes. So the phagocytic cells do something very important. When a phagocytic cell phagocytizes a bacteria or a virus-infected cell, or perhaps some other parasite, okay, what these phagocytes do is they process that phagocytized cell and they find the antigens. So basically what they do is they kill the enemy and then they look the enemy over and they go, oh, this is how we can identify bad guys, right? Bad guys, you know, if you take a battlefield approach, they wear a certain uniform, right? Right, you can look at it, the bad guys as wearing a certain uniform, quote unquote. And that's what happens with these phagocytic cells, is they identify that uniform, right? Oh, this is how the body can tell that this is a bad cell, right? This is a foreign bacteria. And it is typically through proteins, because proteins tend to be complex molecules that can be used to identify foreign cells. And so the question is, well, how does the immune system know that that bacteria is a foreign cell and not a normal body cell? How does it know? And it knows through a critical group of proteins known as major histocompatibility complex proteins, or the MHCs. This is the primary mechanism by which white blood cells, phagocytes, can determine self versus non-self, right? Is if that organism that gets phagocytized is not exhibiting the right major histocompatibility complex marker, then the white blood cell, the phagocytic cell, will know that that's foreign. It will phagocytize that, and then it will present its antigens to the lymphocytes over in the adaptive immune system. This is the great crossover between the innate and the adaptive immune system. So the phagocytes come in. These are primarily your macrophages and your neutrophils. They use major histocompatibility complexes to determine self versus non-self. And if this is a non-self cell, okay, they will then present those antigens to the lymphocytes. And so these phagocytes are also known as antigen presenting cells, or the APCs. They phagocytize, and then they present the antigens to the lymphocytes. You guys cool with that? Is that making sense so far? Okay, good. This is really complex stuff, so I'm trying to really kind of cut through it and drill down to the most important things. Okay, good deal. So, you have two types of B lymphocytes, okay? You have what are known as your effector B cells or your plasma cells. These are B lymphocytes that actively produce antibodies. And antibodies are also known as No. An antigen, let's make sure we're all on the same page here. An antigen is a molecule
Protein.
on a pathogen. It's typically a protein, is a molecule on a pathogen that can be used to identify that as a foreign invader. You guys okay with that? It is like a uniform on an enemy soldier. And the antigen-presenting cells, the phagocytic cells, phagocytize those foreign invaders, and they present that uniform to the lymphocyte and say, here, lymphocytes, here is how you can identify a foreign invader. And the lymphocytes take that antigen, and they go, oh, cool, I will turn that antigen into an antibody.
Is it a memory cell?
Huh?
Is it a memory cell?
No? Well,
Immunoglobulin.
immunoglobulin. Good. So antibodies are also known as immunoglobulins. Okay, and we'll talk about I think there are 5 general categories of immunoglobulins, but what you need to remember is an immunoglobulin is exactly the same thing as an antibody, right? It's the same, they're synonyms. You guys good with that? All right, cool. So, the antigen gets presented to the B lymphocytes, right? And the B lymphocytes then start producing antibodies, right, from the antigens. You guys good with that? So far, so good? Okay, so when a B lymphocyte is actively producing antibodies, it is known as an effector B cell or a plasma cell. So an effector B cell is the same thing as a plasma cell, just like antibody is the same thing as an immunoglobulin. So this is half of the struggle, is just getting through the terminology and understanding what are synonyms and what aren't. Okay, you guys cool with that? Now, once the infection has been resolved, what these effector cells or these plasma cells do is they go into a dormant state. So they quit producing antibodies and they transition into a dormant state where they're not actively producing antibodies. And when they do that, they are known as memory cells or memory B cells. Are you guys okay with that? So a memory cell is a B lymphocyte that remembers how to produce antibodies, but stops producing them because the infection's over with, right? Now, at some point in the future, if the body comes under attack from that same infection, those memory cells can be converted back over into effector or plasma cells. Does that make sense? You guys go with that? So let's talk about how the memory cells can get converted over to effector cells and how effector cells can be enhanced, how their activity can be enhanced. And part of this is the T lymphocytes, and I've kind of neglected them up to this point, right? I haven't talked about the T lymphocytes. We've just talked about the B lymphocytes. So the T lymphocytes, okay, are not so much the humoral response, not so much in your blood and plasma, but the T lymphocytes are primarily responsible for something known as the cell-mediated response. So this is an intracellular response. This occurs within infected cells. Okay? You guys go with that? And we have two general categories of T lymphocytes. We have what are called the CD8 positive T cells, and these are sometimes just referred to as the CD8 cells, or the CD8 T lymphocytes. Okay? And what these cells do is they attach to a very specific kind of major histocompatibility complex protein. They attach to MHC1, okay, and they cause cellular death. Why would you want to kill off one of your own body cells? Why would you want that to happen?
Because it's not the real one. I didn't say.
It's about to burst and release a bunch of.
Okay, so
virus.
maybe it's infected with a virus. It's a virus factory, right? And you want to kill that thing before it produces lots of virus.
Identity theft.
Viruses. That's a great example, right? Maybe it has been damaged to the point of it's not functioning very well, right? And so it needs to be told, all right, time to die.
Or it's mutated and.
Or it's mutated in a way, right? It's mutated and it's lost its specialization, or it's beginning to divide out of control, right? Yeah. So these CD8 cells, because they cause cellular death, these are also known as cytotoxic cells or cytotoxic T cells, or sometimes they're also known as the killer T cells. Okay? So CD8 positive, CD8 T cells, CD8 cells, cytotoxic T cells, cytotoxic T cells, and killer T cells all mean the same thing. You guys okay with that? So it's all terminology, really. Okay, so those are the CD8s. Now the CD4 T cells, they attach to a different MHC protein. They attach to major histocompatibility complex 2, primarily on the memory cells. And what they do is when the CD4 cells attach to the memory cells, they turn the memory cells into B cells, or into plasma cells or effector cells. So the CD4 T lymphocytes, CD4 positive T lymphocytes, are responsible for activating the plasma cells or the B cells. And these are also known as the helper T cells, right? They're not directly involved in killing anything, right? They help turn on antibody production, right? You good with that? They activate the memory cells into plasma or effector cells. You guys cool with that? And there is a very common disease that involves the helper T cells. It's a viral disease. It actually infects those helper T cells. What is that? HIV, right? The human immunodeficiency virus, right, infects the CD4 cells. And then it destroys the CD4 cells. And when you destroy enough CD4 cells, you impair the body's ability to mount a specific immune response. The body can't mount an antibody response. Why? Because the memory cells are not able to be turned on, right? Because you don't have enough CD4 cells. That is the primary mechanism by which the HIV virus goes on to produce what's known as AIDS, right? Acquired immune deficiency syndrome. And AIDS occurs when your CD4 count falls below certain thresholds. You guys okay with that? And this also explains why certain cancers can occur in patients with HIV and AIDS, because when you have abnormal cells in your body, you can produce antibodies that can attack and destroy those cells, right? And if you're not able to mount an appropriate antibody response against those altered or those mutated or those malformed cells, then those cells can go on to grow and to divide and undifferentiate and metastasize and produce cancers. Okay? You guys good with that? So that's just the big picture of the immune system. The last thing that I want to talk about is the complement pathway. And the complement pathway is a bunch of proteins, okay, in your plasma that do a couple of things. They enhance inflammation. Complement pathway is primarily designed to enhance inflammation, and so it is complementary to the inflammatory response. That's why we call it the complementary pathway. And that's done through different types of molecules like interleukins, okay? And interleukins are communication molecules between white blood cells. Inter, right, means what? Inter means between, right? Interstate, between. Leukin, right? White blood cell. They help communication, and they cause chemotaxis, right? Chemical movement of cells, right? They attract immune cells, right? And this is done through what are known as membrane attack proteins, okay, and opsonization of antigens. And what does opsonization mean? If I opsonize something, what does that mean? Basically, it means I code it, and I put little tags on it, and like little beacons, beep, 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 here I am, do something about me, right? So that's what the complement pathway does, and we'll talk about that and how it's related to inflammation in a little more detail. But I think it's a great time to get you guys on a little break. Let's take a break.